All right. Well, we're glad to be here today with Tia Nielsen from the Gremel Group. Gremel Group is a new strategic partner with and part of Team MLW, Mitch Wealth. So we're glad to have you here today, Tia. Thanks for joining us.
Very honored to be here.
And today, I really want to focus on a topic that's important to everyone that hits retirement age is the topic of Medicare. And the reason we've brought Gremel Group in and Tia specifically to help us and be a strategic partner is this is really her focus, and it's kind of your area of expertise. So I'd like to ask you some questions, but I guess before we start with some specific questions, maybe just give everyone an overview of what Medicare is. We've all been paying into it for decades, and what does it really represent?
Yeah, so as we all see come out of our paychecks every week, Medicare was introduced in 1965 because over only about half people had Medicare or any kind of health insurance at that time. So they were trying to fill that gap of people who didn't have any health insurance. So most people have heard of Parts A and Part B. Part A is inpatient. So anytime you're in the hospital, any skilled nursing, any hospice, and that is the money that comes out of our paycheck every week is for that Part A. So whenever you enroll in that, it is premium free. But the
Okay.
Part B is the outpatient stuff. So going to see your physician, getting some lab work done, going to physical therapy. And that's the part that a lot of people mistake is Part B does have a premium. So even though we did pay in all this time, we do have, when somebody enrolls in Medicare, they do have that premium for Part B. So that is the foundation of what is Medicare. We can get into the weeds of, the Advantage
Sure.
plan, Medigap, the Part Ds, all that stuff too, but
Right.
that is foundation.
And it can get complicated, right? And I think that's what's a little foreboding to folks as they realize they get close to 65 and they need to do something about it. Oftentimes, they're not sure how to go about it, right? So what do you do for Medicare beneficiaries, and how can Medicare beneficiaries benefit from having an agent like you to help them navigate those waters?
A lot of people think that, they come to me, it's like, how much do you charge for your help? I'm a free resource to any of these Medicare beneficiaries. Looking at those advertisements and just trying to navigate like 80 plans in some service areas. You're used to maybe having an employer plan where you've got three plans and you're choosing one, but you step into this world of 87 plans and you're like, what in the world is going on here?
Paralysis by analysis, right?
Yes. And as much as you could do your homework, everybody's saying something different so that the agents could just help you weed out all that information. My mom and I were talking about it this weekend. She was reading the book of her homework and she said, I skipped the chapter on employee benefits because I'm my own employer. So that's never been, an issue for me. So some people get into the weeds of reading stuff they don't really need to read. So we can just kind of help you figure out the rules you need to know. But also we provide yearly claim support. You get a claim and it's $1,000. And I think the statistic is 60 to 70% of all bills are wrong. So you get that bill in the mail and it just doesn't seem right. We're your person. We can call that carrier and just help you navigate that claim. And maybe it was wrong. We fight for you and we advocate for you. And then every year we help you look at your plans. So last year you're on only one med, and then suddenly this year you're on 10 and you're hospitalized. We want to look at a plan that's going to meet those needs every year. And it all
Okay.
changes constantly.
Sure. And like you said, there are a lot of moving parts. So what are the common mistakes you see Medicare beneficiaries making?
Um, there's a couple that come to mind for me. One is when somebody is on an employer plan and they enroll in both parts of Medicare. So they're paying for the employer plan and they're paying for Medicare at the same time when it becomes redundant. Sometimes if someone has a lot of medical needs and, maybe the employer is not, charging you for the employer plan, that can be beneficial. But if you're paying for that employer plan and paying for Medicare, that just kind of becomes redundant. And some people miss out on an opportunity to get Medigap, which would be the highest form of coverage you can get, because you can only get that when you're first eligible without underwriting. You can go through the underwriting process if you're healthy, but if you're not, they can deny. Another one is I say do your research, but at the same time, some people listen too much to their friends and family. And just because their friend thinks it's amazing, they think it's amazing for them. But their friend is, got a million meds and they got 10 different doctors, whereas this one person's super healthy on one med and they could benefit way more from something else.
The folks at the coffee shop might not be the experts you need to be talking to, right?
Yes.
Yeah. Every situation is different. Well, let me ask you this. I'll put you on the spot. You mentioned that you're a free resource. Obviously, you're not in the business, to not make a living and pay your bills too. So just
Yeah.
that we like to be transparent at Midline as well. So how would you, get paid, or how would you make money in helping people through a process like this?
Yeah, the carrier will usually give a commission to the agents, and they're also carriers and the government are fighting right now to make sure that people aren't putting people in plans for the sake of commission. At the end of the day,
Right.
I love what I do, and I'm not gonna lead somebody into a plan because I'm gonna make five more bucks on one than another. At
Right.
the end of the day, yes, I'm getting paid, but I feel happy that you feel comfortable in what decision you're making.
Right. So ultimately, people need to make a decision one way or the other, and depending on what that plan is, you help place it for them. You get compensated directly from the carriers on the plan that they choose, and that's how that is. So it's nothing out of pocket for somebody to use you as a resource. So thanks for clarifying that. And
Absolutely.
what is a maybe a misconception people have about Medicare?
Big one is I would think so too. If I'm paying out of my paycheck every week or weekly or biweekly, whatever, that when you get to Medicare, it's free.
Right.
So, I would hope so with how much we've probably paid into it. But no, there is still that Part B premium that you pay once you get to that point. So people get a little shocked when they enroll in Medicare and they suddenly have this 174 premium that they're paying, which could be cheap compared to what they're paying or a lot more compared to what they're currently paying. So that one's usually a big shock.
Okay, what are some steps for folks to plan for it financially? Maybe ahead of time to kind of head off the monster that obviously there's a cost there. So what can people do financially?
I think I just recently read in Forbes that they estimate that over a lifetime, retirees will need to budget around 400 as a couple, $400,000 in medical expenses. So with the Medicare Part B premium, the right now it's 174.70. That changes and that's different based on your income. You
Right.
can check Medicare.gov for your income brackets. But if we looked at, let's say, a Medigap policy, those will usually be on average, I think right now, 148 a month. And then you need a prescription coverage. So that's gonna be around 55. So, usually around that 350 kind of mark, I say to budget that for, your medical premiums. But for those people on Advantage plans that maybe have really low or zero premium, I still tell them to either get a hospital indemnity plan, which I call the bridge between the Medigap and Advantage. So it just kind of covers if you're in the hospital, you can add like a cancer rider on it sometimes. But if you're not spending that 350 on the premium, put it into an account. And when you have medical expenses, you use it for that.
Sure.
And I think it also, I heard that it's 1 in every 5 years that you have a bad year. So if you're paying that 350, regardless of if that's actually your premium, in 5 years, you're going to save up enough to be more than your max out of pocket for a bad year.
So let's say as somebody closes in on 65 and they see the storm clouds on the horizon, they've got to confront this monster known as Medicare. Like I said, there's a lot of moving parts and it can be foreboding for folks. So
Mhm.
what's your best piece of advice for those that are just starting the Medicare process or planning process, leading up to it? I think it's best, I think you'd agree with probably to plan ahead rather than wait till you turn 65 and bam, you got to make a decision. So what's the best piece of advice there?
Um, I hinted to doing your homework. Try not to get into the weeds with it because I've got a client right now reading through the Medicare and B book, and it's like hundreds of pages. So, kind of get through the basics and maybe find some YouTube videos online that maybe teach you the basics. Once again, agents do it too. So, if you find an agent, they can walk you through, just the basics and understanding it. But also, listen to a couple things, but be open minded about it.
Sure.
Some people come in, they're like, I've heard terrible things about Advantage plans. I don't want them. Don't even show them to me. It's like, be a little open minded because I had one that was dead set that way. And at the end of my appointment, she goes, I really hate you for this, but I'm actually considering it.
Yeah.
So I just like to play a little devil's advocate. Whatever road they decide to go down, I'm happy to take them down that road. But, just be open minded to it.
Yeah, it's kind of like I use the analogy in our business when it comes to, different tools for retirement planning. It's like buying a car, right? I mean, not every car is perfect for every situation. Maserati is a great car, but if you're going to be pulling your travel trailer, you probably don't want a Maserati. You might want an F-250. So
Yes.
Different situation for everyone. Clearly, you mentioned the difference on Medicaid Part or Medicare Part B for different income levels, which comes into the IRMA question and whatnot, as people have concerns on that for folks that are above a certain income threshold. Maybe if you could just touch on that, not again, not to get too far in the weeds here, but
Right.
what can people be on alert for there?
Right. Those income levels change every year. I think right now it's at 203 for joint income. So if you're by yourself, it's I think 101. And just kind of watching that. So as you're pulling out your income, let's say out of an annuity or some sort of retirement account,
Areas, yeah.
to, to be very cautious of looking at those income levels and maybe not pulling out so much. So then you don't get tacked on with those extra IRMA fees.
Right. Okay. Well, this is a great kind of preliminary foray into Medicare, and I would say, you mentioned folks talking to their agent, and that's why we've partnered with you guys. We have clients around the country, and you guys are licensed in multiple states, or can be if needed, if we
Yes.
have clients from wherever it may be across the country. So, we really encourage folks, if you've got questions, and everybody should have some questions on this, to reach out to Mitch Lyons Wealth. We can put you in touch with Tia and the group at Gremel Group to help you kind of navigate those waters and come up with a plan that makes sense for you. So I really appreciate your time, Tia. And for folks that don't know, you can reach out at mitchlyonswealth.com and just request a consultation, and we can put you right in touch with Tia. And it's probably worth a 10, 15-minute conversation. Obviously, there's a lot of dollars on the line, both in protection in terms of healthcare, but also in terms of premium that they could potentially be paying too. So thank you for your time today, Tia, and we'll look forward to talking to you again in the future.
I look forward to it as well. You have a wonderful day.
Right, you too.